So, with the whole COVID-19 pandemic going around, we have now heard this emerging idea that the healthcare system itself is racist. And of course, you should have seen it coming, right? Everything so far that has happened in this country is apparently now based in racism. So, we have this Kentucky governor coming up with a plan to provide healthcare coverage to 100% of Black residents. We're going to save that story and we're going to come back to it because it's very interesting. But I want to start with this whole idea that racism is embedded in the healthcare system. We have an article here, very, very, very long. I'm going to give you the gist of it here. We'll try to read through some parts and skim over others. So they say that the disparities have long been documented. Black people are more likely than white people to die from cancer. They are more likely to suffer from chronic pain, diabetes, and depression. Black children report higher levels of stress. Black mothers are more likely to die in childbirth. These findings are part of a mountain of research cataloging complex, widespread effects that racism has on health and medical care of Black people in the U.S. Those effects stretch back centuries and take different forms, from discriminatory diagnostics to institutional barriers to care, all of which affect a person's health. So, they talk about how George Floyd, has triggered people and awakened them to the idea that racism is in the health system, and now we need to address it. Health disparities still exist because nothing has truly changed. So they're saying that all the way back to the slavery days, nothing has changed in our healthcare system, and that basically Black people do not have the same rights as white people with regards to healthcare. Okay. COVID-19 pandemic has only made those disparities and structural discriminations they are rooted in all the more apparent. Here's where they get into some numbers. Black Americans have been dying at about 2.4 times the rate of white Americans. If Black people were dying at the same rate, at least 13,000 mothers, fathers, sons, daughters would still be alive. Okay. Argument here is that Black Americans are dying at over twice the rate of white Americans. That must mean the system is racist. Hold on a second. When you're going through making an argument and you're claiming that one thing is the source of a problem, you need to have clear evidence. Now, we're going to continue reading, and they might try to get into some of that here. But as you'll see throughout this whole thing, the issue I take with this is it's very vague and a lot of, reaching and stretching to find reasons for why it's racism. So the problem is they don't look at evidence and then come to the idea of, oh, wait, there's racism in the healthcare system. It's backwards. They're starting with this idea that racism is rooted in every single aspect of this country and society. So when you start with that idea, and that's what you're told, you see it on the media, you see it from celebrities, you see it from popular social personalities online. So they're starting with the premise that racism is inherent in every aspect of life. Now, when you start with that premise, you then look for ways to support that and to, bolster it up. So then instead of having good solid evidence for why it might be racist, you're absolutely reaching and stretching so far that people aren't really, if people think through this, they're not going to buy it. But again, you're probably not even catering to people with this article that are going to do their, own research and thinking through it. They're just going to already accept the narrative anyway and say, oh yeah, it's racist. Because a lot of times it's mentioned here, it's not backed up. It's just claiming it's racist. And what that means, to clarify, is you're saying that the reason Black Americans die at 2.4 times the rate of white Americans is because of skin color. That's the stipulation with racism, is that it's happening because of the race, not because of any other factors. It's due to the race. So we'll continue. People of color are now more likely to be infected and more likely to die. What we're seeing here is the direct result of racism. That's the thing slapping us in the face. It's lashing us like whips. very colorful picture painted there. The systemic discrimination that has impacted black health so inordinately dates back to the first ships carrying enslaved Africans that crossed the Atlantic. The colonial narrative of hierarchy and supremacy exists to this day. Again, not backing it up, just claiming that it does. And how do you argue with someone that just claims it exists? All you can do is say, okay, can you back it up? No, it just exists. You can't change their mind. Today, black people in the U.S. are more likely than white people to live in food deserts with limited access to fresh fruits and vegetables. They are less likely to be able to access green spaces and more likely to live in areas without clean water or air. Black children are more likely to grow up in high poverty areas. Black adults are more frequently exposed to greater occupational hazards, often working in frontline jobs across many fields. Do you know what the places they described sound like? Poor areas in cities. Look at what we've seen with all these cities. That's where all this craziness is absolutely breaking out and terrible things are happening. To me, it doesn't sound like an issue with the healthcare system. It sounds like an issue of location, and maybe people should start looking to spread out and move to different locations. I don't know if there's things holding back some of these people in these communities from moving. I mean, if I was seeing this, if I lived in like a poor, decimated city area where, I don't have any access to green space, the air and water is terrible, I can't even get food, I'm going to be looking to get out of there. I mean, at that point, I'm going to go live on a farm or something at that point. It just seems to me like the goal here should be to get people out of these areas. And then look at that. If these are what's causing a majority of the health problems, man, gone. You have people getting out of these areas and getting into more healthy living environments. And, it's probably more expensive to live in the cities anyway. So you might have a better quality of living if you get out of the cities and get to other places. This is a huge country. We have places all the way from coast to coast that you can live that are not cram-packed on top of hundreds of thousands, millions of people. So that's not an issue with the healthcare system. That's an issue with where people are living and the environments they are living in, causing them to have more health problems. And again, is this due to racism? Do they live in these areas because they are black or because of another factor? And can they get out of these areas? And can it be prevented that way? So again, the list goes on. More things shape health. The air you breathe, the food you eat, and the visual representations of what your future look like are all distorted by structural racism. Other kids have internalized ideas of white supremacy, and that will have deep effects on a black child's psyche and body. Black individuals often face baked-in barriers to accessing the resources that could help offset, even in part, impacts of those effects, such as high-quality healthcare. The fact that the black body experiences so much more harm in so many ways compared to other bodies, it really explains how racism continues to hurt people. Again, you are not proving to anyone that it is because of racism. We have seen other factors affecting the healthcare, factors that could be addressed with multiple solutions if you come up with a way, but you're not interested in that. You're interested in just telling people it's racist and trying to give people healthcare. Okay. They go on to talking about how, I'm going to skim through this. We still are only halfway down. They go on to talk about how, stress on black individuals, since they have higher amounts of stress due to discrimination, they have more health problems because stress creates more health problems, and they have more stress because of discrimination. Again, they probably have more stress because, what are they told every freaking day on TV? What is everyone told? What are people told on the internet? What is this narrative being spread is that all these different groups are racist against them, and everyone is out to get them. If I was told that every freaking institution in my country was out to get me, and I am a victim, and there's nothing I can do, and I have no hope other than people, reaching down to save me because there's nothing I can do, yeah, I'd be stressed. I would be very upset. Life would be extremely depressing. So stop telling people that everything's against them and there's nothing they can do. People need to be encouraged and built up and say that you can succeed here. You can do things. That's going to help people a lot more than burying them underneath all this false pretense of racism in every structure in the country. Again, they say everyone feels stressed. Black people feel it more. Then they explain that a lot of people think that the race itself is why there's a difference in, medical outcomes, is because it's genetic. And they argue that no, it's racism based. Doesn't mean it's either. We were taught that, okay. So as we get towards the end, they finally try to get to the point where they use specific examples, right? I've been harping on them this whole time. All they're doing is saying, it's racism, it's racism, it's racism. I haven't provided evidence. They provided no evidence towards how the healthcare system is racist. So here we go. We're getting into it. A spirometer, the tool that's used to measure lung capacity. I think you used one of those a long time ago. It's been a while. And I don't remember this button because I took some classes where I had to use one, and I don't remember having to switch it for my black classmates. But apparently, when using a spirometer, there's a button that corrects for race. Interesting to know, right? Black people are measured at a different rubric than white people based on the rationale that dates back to when physicians and plantations used this tool to unjustly rationalize why slaves were fit only for field labor. The same settings are still in use today. Okay. I'll give it to you. There's a chance that somewhere in some doctor's office, there's a spirometer with this button that might have been used today by a doctor that isn't really qualified and doesn't know a whole lot about it. There's a chance that it happened, and maybe you found an example. But you're trying to tell me here that as a whole, in the medical industry, that doctors across the board are still being taught to use methods from the old plantation days that you somehow have found as a news article writer is outdated and doesn't work. You're telling me doctors don't know this? You're telling me that the doctors haven't found out that this is not an accurate tool, like the button on there to switch the race? You think they don't know that? So we should definitely assume they know that. They were probably taught this. If you know this, then they would all know this. So then what would it have to be if they're still using it today? Well, then, yeah, all these doctors would be super racist if they're purposefully using a setting that, provides false outcomes for black people. Then yeah, that's terrible. But I highly doubt if doctors knew about this, which they probably do, and the button is even still on new ones that are made today and ones that are still used. You haven't shown me anything like that. If you can show me, if you had been like, hey, back in 2011 or 2015, whenever, a guy named James went into the hospital and they were testing his lungs and yada yada, whatever happens, and there was some form of medical malpractice because they used this button or a story involved in this, maybe, but it really sounds like you Googled evidences of racism in the healthcare system and you found an article about how a spirometer was used back in the old days that had different buttons on it for different races. Like, come on, show me something that is happening right now in the healthcare system that shows that a tool is purposefully being used to treat people different based on the color of their skin. They also say that algorithms used in hospital care to test for kidney function that have been inaccurately shaped by racism against black people that can harm their health. If that's still being used, absolutely, that needs to be getting rid of. Again, I haven't seen any articles on black people dying in hospitals because the algorithm messed up their test for the kidney function. If that's happening and happening at all, or if it's happening a lot, it needs to be addressed and taken care of. Absolutely. And if that's happening, across the board in all these hospitals, then yeah, there you go. There's some evidence, but other than slightly addressing it, we don't know if that's still happening, if it's happening a lot. Again, very briefly mentioned here. The main focus is to just alert you that there is racism in the medical system. And it continues. So we come back. So before we read this article, you have this narrative being laid out, and I have another one here. Doctors are going out with the protest, claiming the same things, right? That the healthcare system is racist. And when we looked at it, what did we look at? We saw that there are different factors that can cause people in different communities to maybe have more health problems, like they said, stress or different living conditions. Now, those don't necessarily, you're claiming that, okay, maybe those are the racist things. It's not racist in the healthcare. The healthcare system isn't racist. It's those things, okay? Is the cause of those things racism? Is it based on color of skin? That's what you got to look at. You throw this term out anytime it affects someone of a specific color or specific amount of melanin in their skin. Like, just because someone is a specific race and something happens to them doesn't mean that it's racist. I've said this before in the videos of officers with police brutality and the stories that come out. Could some of those cops be racist in what happens? It very well could be. Look at the history of things they've said. Do they act like racist people? Or are they just people in positions of power abusing their authority? Because, you know what? People of every stinking race are sometimes abused by the cops. There have been videos and evidence of white people getting abused too. Now you'll argue, oh, it's different rates. It happens to everybody, and you can't attribute racism just because of the color, is what I'm saying. It's not necessarily the cause every time. Is it the cause sometimes? Yes. And you know what? It would be a lot better if you would actually look into things and find when it is the cause and when it's not, because you're devaluing this word racism. You're turning racism into an insult that people just sling out anytime something happens like this, and then everybody's going to roll their eyes at you and be like, oh, it's just another guy saying racist. He doesn't mean anything. It's losing its weight and its impact, because real racism does exist. It's not as prevalent as you may think, or at least you can't show me that it's as prevalent as you may think. I haven't seen any evidence for that yet. You just claim it is. So you're claiming it's in the healthcare system. You're claiming all this stuff. So what is the result of all this, this narrative being laid out, right? It's being hammered. It's being hammered into us. We're being told it's all racist. This is what happens. You now have a Kentucky governor coming out with a plan to provide healthcare coverage to 100% of black residents. So, the Kentucky governor announced that his administration will be working to end healthcare inequalities in black communities with the aim of providing coverage to 100% of the state's African American residents. The Democratic Kentucky governor vowed to begin working toward tangible changes in the state's healthcare system, focusing on a three-pronged approach to improving healthcare for everybody. Baser said coverage, access, and quality are the main components of his push to reduce inequality among racial and socioeconomic lines. Echoing the promise of many progressive federal lawmakers, Baser said Monday that his daily coronavirus press conference, he believes healthcare is a human right. Hold on a second. There's a few things right there. First off, healthcare is a basic human right. It's actually not. And do you know why? Of course. And on the surface, I understand why you might think that, right? You're like, whoa, I don't want people getting sick and dying. They should be able to, have health care and get their problems fixed so they don't die, right? That's a good thing, right? Here's why it's not a right. For you to get health care, someone else has to either pay for it or perform it or do it. It requires someone else to do something. Your real human rights, such as free speech, don't require anything from anything else. You have the freedom to say what you want. Your right to bear arms. You have the right to defend yourself and protect yourself. The right to not have soldiers quartered in your house and government stepping in and putting soldiers in your house. That's your place. They can't force that upon you. Your human rights are all about, what you can do and your protections. Yes, sickness can affect you and you're like, okay, yeah, that's a human right. I shouldn't get sick. I shouldn't die. I should be protected from that. But you are forcing someone else to either pay for fixing that or to volunteer their time and resources to fix that. So you're then, what if, you can't force a doctor or a nurse to volunteer their time. You have to fix me. You have to come over here and fix me. I'm not going to pay you, but you do. That's not a human right. You're forcing someone else into doing something. Okay? There's a difference there. And while you might think that's upsetting and wrong, that's how it is. It's a privilege. It's a good thing to have. And you see this, in this whole healthcare for everyone, healthcare for everybody. And it's a human privilege that, you can choose to, put your resources into getting healthcare. And yes, it can be expensive. And why is that? A lot of times it's because issues with the government interfering with healthcare. If you had a completely free market system of healthcare, a lot more people would probably have better healthcare. And we've seen evidence of that. Don't try to argue that, universal healthcare is a good thing. Any evidence we've seen, it has very, very poor quality healthcare. And that's interesting because coverage, access, and quality are the main components. Quality? Okay, you're going to have coverage. You could argue that you wouldn't even have access with universal healthcare because people can't get in to get basic things taken care of. Just look at the stories that come out of Canada with, I can't remember the young girl's name, dying because they can't have, simple treatments because the wait lines are so long, or, they get denied because it's not important enough to be taken care of. Because when everyone has full healthcare coverage for everything, it's not physically possible to see everybody for every single thing they claim to come in and have. You're going to have people that don't get seen, and then quality is just crap. So if people are putting, their own money into getting the healthcare they want or getting a healthcare plan, that's more money into the healthcare system. More people can get covered for what they need because that's what their priorities put on. So if these are the main concerns and you're talking about just giving it to everybody because it's a basic human right, you're not going to achieve all of these things here. It's going to be pretty crappy. But the part that, we'll continue before I rant anymore on that. So my commitment today is we're going to begin an effective effort to cover 100% of individuals in our Black and African American communities. Everybody. The governor said during his Monday address, we're going to be putting dollars behind it. We're going to have a multifaceted campaign to do it. But it's time, especially during COVID-19, when we see what happens when you don't have coverage. We need to make sure everybody does. To be fair, he did say everybody. But at the beginning, the effort is going to focus on covering 100% of individuals in our Black and African American communities. So what you're saying there is everyone here who is going to be paying their taxes and, everyone in the state is going to be paying for healthcare for 100% of Black individuals. Now, his goal eventually is to get to everybody, and we already said that's a bad idea. But imagine in this situation, you have a community or a whole state, and your governor comes up to you and says, and you're Black, and your governor says, hey, just so you know, we're going to be having a new healthcare system, put into place here, and there's going to be coverage for everybody at some point. But first, we're going to focus on the white people, and we're going to provide 100% coverage to all the white people, and then we'll get to you next. Granted, I think this healthcare for everyone system where the government provides it is terrible and not a good idea. People should be taking care of their own. But on top of that, saying that you're going to prioritize by race is very, very interesting ground to tread on here. And of course, it's not going to be criticized. And if you provide an alternate example like I did, you're going to be called a racist and terrible. And people will even, I guarantee you, people will look at that and say, well, that's how it already is. It already favors white people 100%. Can you oh my goodness. Oh, so we'll move on. He's going to make commitment to coverage, believe healthcare is a basic human right. I want everyone to have some form of healthcare coverage. Yeah, you know what? Instead, there he is. Great. So instead of everyone being forced to pay for everyone else's healthcare, let people get their own health. Give it to the free market system, not the corrupt free market system, the true free market system. And don't try to put government, whenever you put your hand in stuff, you're like King Midas, but instead of gold, you turn everything to crap. So quit putting your hand in everything, because it turns to crap. And do you know what we've seen? So people will be able to, get their own healthcare plans, let people take care of that. The people who can't, do you know what you should leave that to? People will reach out. And have you seen what's been going on during the pandemic with things such as like GoFundMe's and whatnot? People will see people's homes get destroyed or something like that. Someone will bring it to attention of others, and they donate thousands or hundreds of thousands of dollars. One family just got, I think, was it $500,000? Another guy got, like $50,000 for a business. People give money to those in need. And in general, people can be very charitable. And if you let people do that instead of forcing people to do that, and then you don't handle it very well, the people can handle it a lot better themselves than you being the middleman. We don't need you to be the middleman. We don't need you to take care of things. So, letting people get their own coverage, a lot of people would have it, probably even more would have it. And then the people that don't, someone is like, my cousin's got cancer, he can't afford the treatments, can someone help us out? You've got people in different communities all over the place, whether people from multiple religions and beliefs. People like to help people, and we've seen evidence of that, and we've seen it happen. So let people do that and quit forcing stuff like this, because this does not look good and this does not help. But in conclusion, no, healthcare is not a human right, and now you've got governors turning it into race-based things and prioritizing based on race. Like, do this in any other direction other than the one he's doing, and you have people slinging the term racist at you 24/7. This is only deemed okay because there's an apparent racism culture, built into this country, and everyone's a freaking racist, according to the world, or at least media. So we're seeing things like this. We're seeing people kneel down to other people, apologizing for things they never did and never even thought, apologizing for something that exists in the system. And you know what? Retorts at this and arguments against it, when people like me say something like this, instantly just called, racist and terrible, because we don't believe there is systemic racism. And that's because people that are arguing with us aren't listening. Use these. Listen. Because we're not saying that racism does not exist. We're saying that it's not prevalent in every aspect of society, and that everyone out there is not, out there to get you. It'd be great if, instead of calling everyone a blanket racist and attributing everything as racism, honestly examine situations. And then, can you imagine if we dial back a second and everyone was 100% honest? I know this is never going to happen, but if everyone was 100% honest with themselves and really found out, looked for actual instances of racism and people being racist in their behavior, like wow, look at what that guy actually, did. That is a terrible thing. And you had proof that it was because of his skin color, or at least really good evidence, and not just claimed that it happened because of skin color, you would have, a lot more unified people and a lot more people wanting to, or you'd have a lot more people pushing for a better society. But that is all for today's segment. Thank you guys for tuning in. Don't forget to leave a like and subscribe so you can get notified of any new segments coming out. Additionally, leave a comment if you had any thoughts on this video. If you can, share it with others. If you were highly offended, I'm sure I'll hear about it, and I don't need to tell you to leave a comment or a dislike because you're going to do that before the video probably even starts. All right. Thank you guys for tuning in, and we will see you in the next one.